Hello, my name is Danielle and I will be your nurse today. Today we are going to do a head-to-toe assessment. Can you tell me your full name and date of birth?
Tyler David Warren, 12/12/96.
Okay. Before we get started, I have a few questions to ask you. Do you wear sunscreen when you go outside?
I do not.
Okay. It is recommended that you apply sunscreen every time you go outside to prevent skin damage and sunburn. How often do you exercise?
Like 5 times a week.
Good. It is recommended to perform regular exercise because it helps prevent weight gain. How often do you get tested for STIs?
Like once a year.
That's good too, because it is recommended to get tested every year, and to reduce the possibility of contracting any STIs, it is recommended to get tested in between sexual partners as well. Okay, let's get started with our assessment. I have already washed my hands and my patient's vital signs were taken and they were all within normal limits. All range of motion and strength were previously tested and within normal limits as well. Can you tell me your full name again?
Tyler Warren.
Can you tell me what day it is today?
Friday.
Do you know where you are right now?
Doctor's office.
Who is the president?
Donald Trump.
Good. My patient is alert and oriented ×4. Do you have any allergies I should be aware of?
Penicillin.
By looking at my patient, I can tell that he appears a stated age. He has an upright posture, he is well groomed, and appropriately dressed for the weather. He maintains eye contact, able to focus, and his speech is clear. His facial features are symmetrical, and there is no signs of any obvious body deformity. His skin color is even and appropriate for his race and ethnicity. At this time, I would check the patient's height and weight, which is appropriate for his body stature. I would also check the patient's vision with the near and far vision tests if they were available. I'm going to examine your head for any bumps, lesions, or infestations. I'm now going to palpate your facial bones. I'm now going to test for the cranial nerve 5, which is the trigeminal nerve. To test this, I will be putting a soft and sharp object on your face, and with your eyes closed, you will tell me which one you feel.
Soft. Sharp. Sharp. Soft. Soft. Sharp.
Good. Patient has sensations in all areas. I will now test for the cranial nerve 7, which controls muscles of the facial expression. Can you wrinkle your forehead? Can you puff out your cheeks? And can you smile? Good. Patient's facial features are symmetric and show no signs of facial drooping. I'm now going to test for a combination. So I'm going to have you look at the pen and follow it with your eyes. Good. Now I'm going to check your pupils. Good. My patient's pupils are round, equal, and reactive to light, and they accommodate. I am now going to test for the 6 cardinal gaze. Good. I'm going to palpate your eyelids. I'm going to check your conjunctiva. Patient's conjunctiva is pink and the scleras are white. I'm going to perform the confrontation test. This will assess if one side of the vision is able to be seen or not. Put your right hand over your right eye. And I'm going to hold fingers up and you're going to tell me what numbers you see.
4, 2, 1, 3.
Good. And now do it with your other eye.
2, 4, 5, 1.
Good. I'm now going to perform a sinus transillumination test. I will shine a pen light into your nostrils. Good. There's no redness or irritation. There's also no drainage or signs of a deviated septum. I'm going to have you plug one side of your nostrils and breathe in or out. And now the other one. I'm checking for aeration. The patient has a patent airway. I can see that my patient's auricles is the same color as his facial skin. They're symmetrical and they're aligned with the outer canthus of the eye. The pinna is able to recoil after being folded. And now I'm going to look into your ears. He has no impactation of cerebrum. Now I am going to perform a whisper test. I'm going to stand behind you and you're going to plug one of your ears first. And I am going to whisper a sequence of numbers and letters. D1Q. And repeat it back.
D1Q.
Okay, now do it with the other ear.
A7S.
Good. I am now going to check my patient's mouth. So you can open your mouth, stick your tongue out, say ah.
Ah.
Good. So the lips, tongue, and gums are moist and pink. The uvula moves back and forth as it should. I'm going to palpate the carotid artery. Good. Carotid artery pulse is +2 bilaterally. I'm now going to palpate the thyroid gland and the lymph nodes. No swelling in the lymph nodes and there's no enlargement in the thyroid. I can tell by looking at my patient that he is not experiencing any labored breathing and that he is not using any accessory muscles. He's exhibiting quiet, rhythmic, and effortless respirations. I'm going to listen to your lungs anteriorly and posteriorly. Take a deep breath. Take another deep breath. Good. And now I'm going to listen posteriorly. Take a deep breath. Good. My patient has normal respiration and no signs of any dyspnea. I'm now going to check for jugular vein distension. You're going to sit upright and turn your head to your left shoulder and then to your right. There are no signs of any jugular vein distension. I'm now going to have you lay down and I'm going to listen to your heart. I'm now going to listen to the 5 heart sounds. S1 and S2 sounds are present. There are no abnormal heart sounds or any signs of murmurs. I am now going to perform some tests to check for any lung consolidation. I am going to listen to your chest and have you whisper 1, 2, 3. Now can you say 99 out loud?
99.
And can you say the E?
E.
Good. So there's no signs of any lung consolidation present. You can sit upright now. I'm going to inspect the skin, shape, and muscular development of my patient. The patient's skin is intact and muscular development is symmetric and normal. I'm now going to perform the gastrovertebral tenderness test. This is going to assess for any signs of kidney infection. I'm going to place my palm on your back and gently thump it with my other hand and let me know if you feel any pain.
No. No.
Good. So there's no signs of pain, so there is no signs of any kidney infections. The skin is warm with no lesion, lumps, or scars. I will now assess your radial pulse. Good. Pulses are +2 bilaterally. I will now assess for capillary refill on my patient. Capillary refill is good. It's less than 3 seconds. I'm now going to perform the Tinel and Fallon test. I'm going to tap on the medial nerve of your wrist and let me know if you feel any pain or tingliness.
No.
Okay. Now for the Fallon test, we're going to do the inverted prayer hand. So you're going to hold your hands like this and let me know if you feel any pain or tingliness.
No.
Good. So these tests, the Tinel and Fallon tests, are performed to see any signs of symptoms of carpal tunnel syndrome in my patient, and there is no signs present. Now I'm going to perform the stereognosis test. This is going to assess the function of the parietal lobe of the brain. I'm going to place 3 different objects in your hand and you'll tell me what they are with your eyes closed.
Key.
Okay.
Coin.
Okay.
A pair of scissors.
I'm now going to perform the graphesthesia test. This is going to assess your sense of touch. You are going to close your eyes and I will be drawing 3 different numbers on your hand and you'll tell me what they are.
7. 1. 8.
Good. Next, I will be performing the kinesthesia test. This test will test your awareness of movement. So you will lie back down. When your eyes are closed, I will move one of your arms and you'll mimic the movement with your other arm. Good. I'm now going to move on to the abdomen. By looking at my patient, I can tell that he has a symmetric contour. His abdomen is not distended and is uniform in color without any blemishes. There is also no lumps, lesions, pulsations, or scars present. I'm going to osculate for bowel sounds. There are bowel sounds in all 4 quadrants. Now we are going to perform the shifting dullness and fluid wave test. This is going to test for any ascites. So I'm going to have you press down on the midline of your abdomen with your hand, and I'm going to hold one side of your stomach and tap the other and see if I feel any fluid. There's no sign of any fluid, so my patient has no signs of any ascites. I'm going to perform the rebound tenderness test now. This assesses for any peritonitis. Do you feel any pain?
No.
Good. My patient has no sign of pain, so there's no sign of any peritonitis. I'm going to perform the Murphy sign test, and this is going to assess for the acute cholecystitis. I'm going to have you sit upwards. I'm going to place my hand on your upper right quadrant of your stomach and have you take a deep breath out and let me know if you feel any pain.
No.
Okay, good. So you can lay back down. We're going to move on to the lower extremities. The patient's skin is dry and warm and there's no bumps, abrasions, lesions, or scarring. I'm going to check for edema. There's no edema present. I'm now going to check for pulses in the feet. Pulses are +2 bilaterally. Can you wiggle your toes? Good. I'm now going to perform the bulge embowelment test. This is going to assess for any fluid or swelling in your knee. I'm going to apply pressure to the top and bottom of your knee and then place a finger in the middle. No fluid. No fluid. Now I'm going to perform the obtruder sign test. This is going to assess for any irritation to the obtruder internus muscle. I'm going to have you stay lying down and I'm going to flex your knee and hip to 90 degrees. You're going to let me know if you feel any pain.
No.
Good.
No.
Good. Now I'm going to perform the straight leg test. This assesses for any underlying signs of a herniated disc. I'm going to lift your legs until I feel resistance, and you're going to let me know if you feel any pain.
No. No.
Okay. I'm now going to perform the ellipsois test. This assesses for any irritation of the ellipsois group of hip flexors. I'm going to have you lie on your left side, and you're going to take your left thigh and flex it backwards. Do you have any pain?
No.
Good. So you can sit back up. To finish this assessment, you can stand up. I'm going to perform the Romberg test. This is going to assess your balance. So you're going to stand with your feet together, your arms by your side, and close your eyes. Good. My patient has a good sense of balance. I'm now going to have you walk forward a few steps and then back. I'm observing my patient's gait. My patient has an upright posture and a steady gait with opposing arms swinging by his side unaided. I'm now going to assess for the scoliosis test. So you're going to turn sideways, bend at your hip, and I'm going to check for any spine curvature. There's no spine curvature present, so my patient doesn't have any scoliosis. This is the end of the assessment. Do you have any questions?
No.